Quality Watch is an educational production of IPRO. Opinions expressed reflect the views of the speakers only and not those of any company or agency. This podcast is intended for private, non-commercial use only. Please visit ipro.org to read our full disclaimer and terms and conditions.
Welcome to Quality Watch, the podcast focused on healthcare quality improvement. Quality Watch is a production of IPRO, a trusted partner of federal and state agencies working to measure and improve the quality of healthcare for all. I'm your host, Dr. Edison Machado, Senior Vice President of Strategy Solutions here at IPRO. In today's episode, we'll share a look back at 50 years of healthcare quality improvement. But first, a few quick headlines and updates from around the nation and here at IPRO. The gene editing technology known as CRISPR has found its first FDA-approved clinical application with a new treatment for sickle cell disease. In clinical studies, the treatment was shown to reduce pain and disability associated with the disease for up to 1 year. Longer-term studies are needed, but this represents a major breakthrough and for the first time, a potential cure for a condition that affects about 100,000 people across the country. With input from advocates and members of the disability community, the director of the National Institutes on Minority Health and Health Disparities recently designated people with disabilities as a population with health disparities. This decision recognizes the fact that people with disabilities often experience discrimination, inequality, and exclusionary policies that may limit their access to care. And as we all know, the winter holiday season coincides with respiratory illness season. Rates of RSV and COVID-19 are unfortunately back up on the rise. This year, there is a new RSV vaccine that is recommended for those 60 and over, and consumers have options for updated COVID-19 vaccines. So in addition to the mRNA formulations from Pfizer and Moderna, a protein-based non-mRNA vaccine from Novavax has been granted FDA emergency use authorization for those 12 and over interested in getting their up-to-date COVID-19 vaccination. Please speak with your provider to confirm which vaccines are right for you. Nearly 40 years ago, IPRO opened its doors as a peer review organization in Rego Park, New York. A lot has changed over the ensuing 4 decades since it opened its doors. IPRO is now one of the largest healthcare quality improvement organizations in the country. Harry Fader has been IPRO's Chief Operating Officer since 1987. He recently announced his intention to retire after 37 years at IPRO and over 50 years working in the healthcare industry. Before he departs, we invited Harry to join us on our Quality Watch podcast to hear his perspectives on the healthcare quality industry, past, present, and future. Welcome, Harry.
Thank you, Eddie.
Well, let's get started. Why don't we begin by having you walk us through your early career? How did you happen to get involved in this type of work?
Well, it was interesting. I went and got my master's at NYU in public administration. And that was after deciding I wasn't going to be an attorney because my sister and brother are both attorneys. So I was taught, a friend of mine was the administrator at Montefiore Hospital. And he said, try public health. And I then went on, did my internship and residency at Montefiore, and was just appointed assistant administrator when the COO of the hospital, Mo Katz at the time, asked me to attend a meeting in Washington on this thing called Professional Standards Review Organizations, known as PSROs. I took a plane on April 1st, 1975 to D.C., and it was at that point I met 200 people who were beginning to plan out the quality improvements. The whole QIO program, or PSROs in those days, was built in reaction to the Medicare and Medicaid being established in the mid-1960s. And by that time, the federal government realized we were spending too much money. There was no oversight. And it was both looking at the oversight on the medical necessity and quality of care provided, but also the utilization and the costs. So in the beginning, it was both quality and UR. And that's how I got involved. I came back from that, never knew how to write or respond to an RFP. I was only 24 at the time. And I then wrote an RFP, and we received the second most amount in the country. In that time, New York was divided into 17 PSROs. By 1984, the PSRO program becomes the QIO program, the Quality Improvement Organizations. And we then go from 200 plus organizations down to 54 organizations. That is when IPRO was formed. IPRO was formed by the PSROs in the counties of Nassau, Suffolk, Brooklyn, Queens, and Staten Island.
Got it.
And it was a subsidiary to the Empire State Medical and Scientific and Education Foundation, which was run by the Medical Society of New York. By now, getting to 1987, I was responsible and had the contracts as the Bronx PSRO and Comprehensive Medical Review for basically all of the Health and Hospitals Corporation and all the Medicaid from the Bronx in Manhattan all the way upstate, so covering most of the state. At that point in 1987, the Department of Health issues an RFP and they only want to do 2 regions. In conversations, Ted and I, who were friends at the time, decide that we're going to merge. And so the Comprehensive Medical Review merges into IPRO. And at that point, IPRO had the Medicaid for Long Island and Queens. And we decide to bid for all of downstate together. We win that contract in May of 87. And at that point, we get merged together. Ted is the CEO and me as the COO.
Wow. Well, that's quite an amazing history on how you found your way and ultimately how, what's known as IPRO today came to be. So, Harry, can you tell us a little bit, those early days, what was the nature of the work, that you and, the early employees here at IPRO were doing?
The first work related, and I'll go back before the 84,
Sure.
The first work was looking, and this was before DRGs even come about. So we were doing per diem reviews, line by line reviews, similar to what we do on cost outliers to make sure that the services ordered were rendered.
Got it. Okay.
Simultaneously, so that was on the utilization review side. Simultaneously, we began doing quality improvement. They were called MCEs, medical care evaluation studies. And those were the first step of the government trying to say, hey, we need to improve the quality of care provided to the Medicare and Medicaid recipients. In the early days, the QIO program included Medicare and Medicaid, but the states then decided they wanted to do it on their own, and ultimately that leads to QROs.
Got it. Okay. So when you think about the work you did, you and your colleagues did back then versus the type of work the organization IPRO does today, how would you compare it, I guess?
People ask me, how can you stay in the same job for 49 years? It's not the same job. When we started with the merger in 87, I think we were like 30 or 40 employees. Today we're 400 and we've been up to 500 at some points in time. Very different work. The analytics, the data systems, I remember typewriters. We were happy when we had the IBM Ball typewriter. Today it's a total different way of operating. So the use of data, you had the whole Quality Improvement Network, the National Quality Forum gets put together under Clinton. So there's been major changes. It's not the same. And it moves much more quickly.
Got it.
In the old days, you're happy, you got a fax, you had time to respond to a fax, and maybe you started getting emails and now texting. And now all of a sudden people want a response by the moment they send you a text or an email or a notice. before you had time to breathe, put it in the mail,
Sure.
But it's a very different world today. And the sophistication of the staff has grown. The staff we had in the beginning, yes, there were nurses learning how to deal with paper. And that was an issue. And today I think you have more and more experienced nurses who understand how to use data, who understand how to do quality improvement, and understand how to work with providers, as well as the analysts and the staff that go with that. So it's a totally different world.
Got it. Yeah, I mean, it sounds like the work is obviously changed, but as you point out, the associated staff, right, that IPRO really counts on to do the work has also changed, right, in their level of sophistication. And, 4 decades later, the organization continues to endure and grow and expand. And I guess, what I would be interested in hearing from you, Harry, is, over that time period, if you could really put your finger on your proudest accomplishment, what do you think that would be?
It's the staff. The quality of the staff that has been unbelievable. I can point to one area which I've mentioned relating to newborn, the transmission of HIV to a mother, from mother to child, and how with antiretroviral treatments, even upon admission, we've cut that down to less than a handful of babies a year that are delivered with HIV who are positive.
Wow.
Just think of that is to the quality of life, not just to the mother, but to the child.
Sure.
And what the costs are. That child would have been millions of dollars just for treatment and bringing them around. And by not getting transmitted HIV, that's a major issue. And, to me, you save one life, you save the whole world. And we do that every day with the work that we've done.
No, that's really great. And I mean, when you think back to the height of HIV and AIDS, and to really be able nowadays to make that statement, right? I mean, in and of itself is a very big deal.
Decades that this is going on, that we have saved thousands and thousands of children from being HIV positive. And that's, you can say, one of the proudest times. The other things that were great was, I love the special projects, whether we did Ebola and we embedded people within JFK and interviewed people beyond the requirements. For 911, when those towers went down, I had just voted on September 11th and got into my car, and I was going over the Frogs Lake Bridge when I hear, and it was a beautiful sunny day, and I hear that another plane went into the towers, and we then within hours, thanks to Rich and the staff here, we set up to be the telephone system for if you needed health care for the whole metropolitan area.
Wow.
It was
incredible.
AT&T really. And all the staff were here 24/7 to make sure people got the dialysis services they need or the medication services. It was interesting that morning that we were supposed to go live. Before it was announced by the Secretary of Health and Human Services, the CMS administrator actually 10 minutes before 9, when they were going live, called to make sure that we had people there to answer the phone.
Oh, no kidding.
So
wow.
I give compliments to CMS that they knew this was an important part, and our role in it was really tremendous. And it's a compliment to everybody who just jumped in, and whether from telephones to nurses and to working with the pharmacies and the EMS across the country. It was great.
Now that's great to hear. And I'm sure it's a big reason why staff come to IPRO and choose to stay, right, for the time that they do.
Or some people who leave and then come back.
Yeah, no, that is another characteristic, right, that shows up. And it's a good one, right? Obviously, that people feel comfortable enough and interested enough to come back. So again, that's, we talked a little bit about, the origins of IPRO and some of the great work. Where do you think, though, now the industry is headed? The healthcare quality improvement industry is headed, say, the next 5-10 years, Harry? If you had to take a look at the crystal ball, what would you
leave that to you to work on? No, I think quality improvement and the role we play is going to grow. I really think there's a new emphasis. There's a recognition that the government is spending a lot of money on Medicare and Medicaid, and that we need to make sure that the patients are getting the appropriate treatment and services. It's very different. We're looking more at, rather than the individual cases, we're looking at pattern of problems and trying to work with that. I think CMS is recognizing that with the new Quinn 13th scope of work. And even New York State is recognizing that in the external quality review organizations. We were one of the first, just for background, we were one of the first EQROs in the country. And it all happened by accident. The deputy Medicaid director, Sue Kelly, calls me in I believe it was 1990, and said, and we were the URQI agent. She said, "Do you think you can do this?" Well, for those of you who know me, Harry always thinks he can do everything. And yes, we have, and that has been one of the most successful programs. It's representing about almost 25% of IPRO today. So
Yeah.
those are great things that we've been able to build. And then you come up with a new program like IDREs, the Independent Dispute Resolution Entities.
Yep.
And again, we were one of the first companies in the country doing that, and it's become a very successful program here at IPRO. And just for those of you who are not familiar with IDREs, it's when the patient has the right to an appeal for the services to get paid, where the provider and the doctor and versus the plans disagree. So that's been very successful, and it's the fastest growing department at IPRO now with over 35 staff. So and it's only a 1.5-year old program.
Yeah, no, as you mentioned earlier, right, things seem to just be moving faster and more sophisticated. But, it seems like IPRO has been able to keep pace, right? And really been there to help clients as they need it.
100%. If you look at our surveys of our customers, and I'm talking that basically 95% of our customers are state and government agencies. Those surveys come back, we get the highest level. What is that? On the scale of 5, we're at 4.8.
Yep.
And that's great. That shows that we care about the customer, and by caring about the customer, they care about the quality of care and the services we provide. So that's really great.
Great. So Harry, as you begin to prepare to, step away from day-to-day work here at IPRO, what's your, I guess, words of advice or guidance for folks here at the organization, whether it be, staff at the front versus all the way up to leadership? Like, what are your, I guess, words of wisdom for the organization?
Keep your eye on the ball. Improving the quality of care. We're here to serve, and the goal is to improve quality of care. Whether it could be whether you have a relative in California or a relative in Florida, you want to know that they're getting the appropriate services as if they were living here in New York. And it's a national program, and you need to look at it from the national perspective. My advice is when you get to retirement and thinking about retirement, I feel today the closer it is, the further I want it. But
sure.
There's a time in life for everything, and a time to move on. But I urge you to work together, recognizing that we are a team, whether you're in these divisions that I oversee or the divisions that Claire oversees. That we're in this together as an organization, and we need to work together. There are times that there is change. There's going to be change in the Quinn 13 scope of work. There's going to be change in the Medicaid programs. And we need to be able to go along with the change and recognize it as a positive, not as a negative.
Well said, Harry. And, I think it goes without being said, but your knowledge, your just nature will be sorely missed here on a day-to-day basis here in the organization. And I know you're not stepping away completely, which we're happy about, honestly. And I think the organization will benefit. But, I can't even begin to tell you, how much of an impact you've had in shaping the organization. And, we can only hope that the the next few years or 40 years will be anywhere near the picture that it's been for the initial 40.
Well, my hope is that as a legacy is that it continues.
Yep.
To me, the worst thing would be, you close down in 6 months of the organization. The legacy is the work we've done, Ted, myself, everybody else, the people who's passed through these doors, and I can think of a number of them, those who passed on.
Sure.
And I know I leave you in good hands with some of the younger folks like you, Eddie, like Matt, and there are hundreds I could mention. And I know the future looks great for IPRO, and I'm glad to have participated and been part of the growth of the corporation.
Heartfelt thank you, Harry, really for joining us today and for all your hard work. And for our listeners, if you want to learn a little bit more about IPRO and some of the 40-year history that the organization has been able to have, and we're going to be celebrating that over the upcoming year, as well as our current work, please feel free to visit our website at ipro.org, ipro.org, which you can find in the Quality Watch show notes. It's time for us to crunch some numbers in our Data Watch portion of the program. Here's some troubling news about healthcare in America. Despite spending far more in healthcare than any other high-income nation, the U.S. continues to perform worse than average on 77% of health status indicators like life expectancy, obesity, and opioid mortality rate. This is all according to a report from the Organization for Economic Cooperation and Development. Rising healthcare costs mean many Americans struggle to afford medical care. A recent Commonwealth Fund survey found that 1/3 of Medicare beneficiaries have difficulty paying for healthcare, while 20% say they have delayed or skipped essential healthcare because of the cost. At the same time, 20% of Medicare beneficiaries say their healthcare costs have made it hard for them to pay for food and utility bills. The Kaiser Family Foundation has reported similar findings. It says that about 40% of adults in the U.S. have delayed or foregone medical care, especially dental care, due to cost, and about a quarter of U.S. adults are not filling prescriptions or are cutting pills in half or skipping doses to save money. Black and Hispanic adults, as well as those with low incomes, are disproportionately affected by these rising costs. Well, that's it for this episode of Quality Watch. I'm Dr. Edison Machado, and on behalf of IPRO, thank you for listening. To learn more, visit our website at ipro.org. That's IPRO.org. If you've enjoyed this podcast, please feel free to leave us a comment and subscribe wherever you listen to your podcasts. We will be back next month with more. Until then, we'll be working on better healthcare realized.